From Fertility CARE, the IVF Center here in Orlando, Florida. I hope you had a great weekend. Nice to be with you all again. Today, as you read, it's about ovulation. So, trivia question to start off. What's the only way you definitively know you've ovulated? Pregnancy. It may sound intuitive, but all the tests for ovulation are presumptive for ovulation, okay? You can actually get hormonal changes and not release an egg. You can actually have the signs of ultrasound and basal body temperature and so on and so forth, okay? So there are a lot of ways to presume you've ovulated, but the only way that you really know that you did is obviously pregnancy, okay? So what are the ways that we know we've ovulated? Well, just a brief review. The first half of the cycle is being driven by the pituitary hormone FSH to tell the ovary to get all those resting antral follicles to develop into an egg, but only one makes it dominant and ovulate, the rest die off. So hundreds of eggs are being lost every month, as I've talked about before, okay? So what happens at the time of ovulation? Well, the pituitary hormone, again now, LH, signals the trigger to release the egg. Okay, LH does that. So the urine can detect high levels of that hormone. Now you can get some false positives in patients with polycystic ovarian syndrome. They sometimes think that they're ovulating because their LH is chronically a little high, okay, than most. So for everyone else though, use it checking the urine. So that's one way, okay? Another one is the torturing basal body temperature chart. I really don't recommend that. I think it's just so much trouble for patients to have to wake up every morning and get their temperature. But that's another way because progesterone can cause a mild elevation in temperature. So if your resting basal body temperature is below 98, and then when you get the elevation above 98, it should last for about 10 days. Unfortunately, with basal body temperature charts, it doesn't tell you that you're ovulating prospectively. The urine LH detection, the OPK kits do. And so when you see that test line that matches your urine detection, you have about a day or two for final relations, okay? And then from that day backward, over those 6 days are the most ideal to have intercourse to try to conceive, okay? So a day or two after the color change, and from that day back 6, that's ideal. What are some other ways? Cervical mucus. In the days preceding ovulation, because of estrogen levels going up, the cervical mucus gets watery to facilitate the sperm transport up into the uterine cavity. After progesterone, it gets thick to prevent further sperm from going up into the uterine cavity and to prevent what's called superfecundation, which is a multiple fertilization from one more egg, actually. So if a woman rarely ovulates more than once, you can get another egg ovulated. Fertilized. Okay, so you can get 2 different fertilizations if you have intercourse after ovulation, if you've ovulated more than one egg, which can happen on occasion. But the reason why the cervical mucus gets thick is because it doesn't want, after fertilization, the potential risk of infection as well for the embryo implanting. And that cervical mucus gets thicker and thicker and thicker, and that's what's passed at the time of labor. That's the cervical mucus plug, okay? So what else? Endometrial biopsy, uncomfortable procedure. We put a catheter inside the uterus and scrape the lining of the uterus. We can actually tell what phase of the cycle you're in. After ovulation, progesterone is the dominant hormone. First half of the cycle is estrogen. So progesterone going up, which is highest a week after ovulation, is another indicator of ovulation, and that's the way we do it. A lot of the clinics will do blood tests for progesterone. The endometrial biopsy can look at the glands on the tissue, and if it shows that it's what's called secretory, which are changes in the glands and the stroma of the lining of the uterus, that also lets us know that you're ovulating, okay? Now, a quick word about progesterone. I think I hit all the reasons for ovulation. Ultrasound is another way that you can determine if somebody is ovulating presumptively, okay? You see dominant follicle, and then if you're monitoring on a daily basis and the follicle's gone, then you presumably have ovulated. Or a week after you think you may have ovulated, you see what's called a corpus luteum, which is a blood-filled cyst that's making a lot of hormones for implantation, okay? So a word about progesterone. Progesterone levels, it doesn't have to be above 10. Just above 3 or so, 3.5, whatever the laboratory is mostly saying in their cutoff values. But the point is that when you first ovulate, progesterone levels are here, and it keeps going up, and then it peaks about a week after ovulation and starts going down. So anywhere along that continuum, progesterone levels could be lower, high, then lower. As long as it's above 3 or so, 3.5, you've ovulated. You don't have a better ovulation. It's really where you get it, okay? So unless you get a progesterone level every day, several times a day, you're never going to know what your peak progesterone level is. Better to have at least 10, 11, 12 days in the second half of the cycle to show that it's a good enough for ovulation. What was the other thing? We talked about ultrasound. I think that's about it. I think we hit all of the issues to know if you're ovulating. Oh, Mittelschmerz, last one. You can get lower abdominal cramping right before you're ready to ovulate, and that's called Mittelschmerz. Sometimes that could be so much of a pain that patients go to the emergency room and it's ovulation. So the capsule of the ovary swells right before you release the egg, and that's the cramping that you feel, and that's called Mittelschmerz. So I hope this clarified information on when I'm ovulating. As always, please send us questions. We'd love to answer them for you, and we will see you next week. Have a fantastic week. Until next time.